Today's podcast is about a subject that has grown increasingly important to me over the past few years, fertility. I'm just going to speak for myself here, but I feel like a lot of other women can relate. But for me, fertility is kind of everything that has to do with what you're taught that being a woman is about. You're a mother, you're a caretaker, you're growing a human life, you're nurturing life, you're literally giving birth to a person. And all of that just comes back to this big idea of mother, and this is kind of your born destiny. And being a woman, this is not to say your job, but this great gift that has been given to you. And for me, I'll get into it, but it's never seemed that simple. It's never just been that easy. So in today's episode, I will talk about fertility and how pituitary tumors relate to a woman's fertility and my own fertility, and what I've learned along the way after my diagnosis, and what I can expect in the months and years to come. After I recorded this particular episode, I realized that there was a lot more that I wanted to cover, not only relating to fertility in my own circumstances and my own situation, but a more general look into fertility and some of the misconceptions and some of the things that aren't as openly talked about as others might be, and my own experiences with some of those things and what I've heard from doctors, and more importantly, what I haven't heard from doctors. So I will be following up this episode next week with a part 2 that, again, will cover kind of a more general look at fertility. After my husband and I got married in 2017, the "when's the baby coming" questions started flooding in. This was before my diagnosis, but it was still pretty annoying. It's a really personal question, but I can understand that for a lot of people, it's an easy conversation starter, and hey, a lot of couples do try for babies immediately after marriage. For me, fertility has always been a concern. For whatever reason, I have always had the suspicion that I would have trouble getting pregnant or be unable to get pregnant even before I was diagnosed with adenomyosis and a pituitary tumor. I don't know where this thought came from, but I've cried over it. I've convinced myself that it's true. In reality, I don't know if I can get pregnant, and I don't know if I can't either. After my diagnosis, my negative thoughts only amplified. High levels of prolactin in the blood can cause infertility. Some women who have macroadenomas, the larger pituitary tumors, can lose their periods, and ovulation might stop altogether. Personally, I have experienced changes in menstruation. At first, I didn't know the cause of these changes. The changes included irregular periods and spotting almost daily. When these changes started happening, I went back to my suspicions and started thinking that I wouldn't be able to get pregnant. It hasn't been easy to deal with, and I'm not ready to start a family at this moment, but the feeling of not being able to conceive and have a child really hurts. Research states that women who have a small is not defined in the research, pituitary tumors can usually, in quotes, conceive and have a normal pregnancy. But that's only after what the researchers call effective medical therapy. By medical therapy, I assume that this journal is referencing the 2 primary medications used to treat prolactinomas, cabergoline and bromocriptine. Of the 2, bromocriptine has a longer history and is considered the safer option of the 2 by physicians. My endocrinologist mentioned this too. Both medications are considered safe for both the baby and mother during the early stages of pregnancy, but their safety throughout the entire pregnancy hasn't been established. The research goes on to say that during pregnancy, the pituitary enlarges and prolactin production increases in women who do not have pituitary disorders. Women who have prolactinomas run the risk of having their pituitary tumor enlarge, which can lead to other serious complications. Because of this, women who have pituitary tumors should see their endocrinologist every 2 months throughout the pregnancy. Less than 3% of women with small prolactinomas have symptoms of tumor growth, including vision problems and headaches. Women with large prolactinomas, again, here large isn't defined in the research, have a greater risk of tumor growth, said to be as high as 30%. Medications like cabergoline and bromocriptine may be reintroduced if a woman is experiencing symptoms of tumor growth, such as headaches, vision changes, nausea, vomiting, excessive urination, thirst, or extreme lethargy. Weird, because all of these, minus the vision changes, to my knowledge, are symptoms of morning sickness. So when does a woman who is living with a pituitary tumor of any size know that her symptoms are something more than morning sickness? Not to mention, the safety of these medications throughout an entire pregnancy have not been established. Now, the when's the baby coming question is a little more touchy for me. I get that the excitement of asking that question comes from a happy and sincere place, but the person asking doesn't always know that there are some serious risks that I have to think about. And not knowing if I can conceive and carry a child is part of the equation too. I had to have a brutal conversation with my mom about this. She knew about my condition, but didn't entirely understand the risks around pregnancy. Every time she would ask, my mood would immediately switch and I would go to a really dark place. It was like a reminder that I might not be able to conceive and that I might be broken despite all of my good-intentioned efforts to lead a healthy life. Then I snapped. After explaining how it could potentially impact my health, specifically the vision impairment and potential blindness, and how her asking the question made me feel, she understood and was very sympathetic to my situation. We're not ready for kids yet, but our unique situation means that we have to start planning now. I'm in this area of a lot of unknowns, and it's something that I am going to pursue to learn more and speak with my doctors and really get into a lot of the tough questions and tough conversations that I haven't been ready to get into. I think it's really important for women, especially those who, like me, kind of identify as, you might be imperfect if you can't have kids, or just because this message has been ingrained into you for the longest period of time, and then your story doesn't quite have the ending that everyone else's does, or your story doesn't look like hers, or she got pregnant so easy, I'm not finding it to be easy. I think it's really important to talk about the fact that it's not always easy, and that there are a lot of options, though, that can really work in our favor when it comes to fertility, and that there are a lot of resources and that there is great information. But for me, my experience is just getting started. And again, I definitely will get into that a little deeper in next week's episode. This is just a friendly reminder that I am not a doctor. Fit Me Daily is a source of information and entertainment. If you have questions about your health, please consult your doctor. Thanks for listening. You can find more about the Fit Me Daily podcast at the Fit Me Daily blog or on Instagram at Fit Me Daily. Remember to rate and review on iTunes and follow Fit Me Daily on Spotify.